Welcome back, Richard. It's good to see you this morning.
Halfway through January, right? Just about flying by. 2024 is going to get ahead of you.
It is flying by, and as fast as time is going, our conversation today is going to be about technology and how fast technology is moving.
Speaking of not being able to keep up with something,
right? So we've
Sure.
all heard about like ChatGPT and all of this AI, business out there that you can type in a couple of words into the engine, and a few seconds later you can have a 10-page paper written on whatever topic really you want. And but interestingly, this is starting to filter into so many other aspects of the world. I don't know if you saw this, Richard, and we didn't talk about this sort of in our pre-game prep for this podcast, but have you seen the congressional hearing where one of the congressmen played a video or played an audio, and it was him making a speech, but he had not made that speech. They put it into an AI, and that AI used his voice, his likeness to create the speech.
Right. I think about evolutionary psychology. We've spent tens of thousands of years getting good at recognizing things, and now what you see may not be real,
right?
Which is going to be a huge shift for us, because we've spent tens of thousands of years developing this ability, and all of a sudden it's going to change.
Yeah,
and that's what happened here. My sister sent this to me just hours before we did our last podcast, so I couldn't do much about it. But she sent this to me, and she said, "Have you heard about this?" She knows what I do. And the title of the article that she sent to me was Character.ai, Young People Turning to Artificial Intelligent Therapist Bots. And I thought, wow, but it's from the BBC. So I thought, well, maybe it hasn't reached here yet, right? But I guess what this does, this Character.ai, and I did look it up, it allows you to talk to somebody in real time.
Right.
You want to talk to Harry Potter? You want to talk to Taylor Swift? You want to talk to Babe Ruth? You can have it. You go on this thing. It's like selecting it's like a jukebox with people instead of songs. You go in, you select who you want to talk to, and you have a conversation.
Okay? Right. And about whatever you want to have a conversation about.
Whatever you want to talk about. So it's about a chat, and chat means chatter. It's a talk with a therapist. She asked me what I thought, and I said, well, BBC, so maybe it's only in England. And I, of course, no. If it's in England, it's here. These things go viral very quickly with young people, and it's young people who are using it.
Right.
And what the article does, and if you're interested, it's in the show notes. It explains what a chatbot is, and a chatbot is chatbot. Bot is short for robot, and chat is short for chatter. So you talk to a robot. That's what chat means. And you, Berney, you told me you signed up for ChatGPT.
Yeah.
Right.
I haven't really used it much anymore, but yeah, I signed up at the OpenAI.
Right. And for those of you who are interested, ChatGPT, you've heard of it. Chat is short for chatter. GPT stands for Generative Pre-trained Transformer. So that's the program that makes it possible for it to talk to you. They call it generative AI, and people are afraid of generative AI. You don't need to be afraid of this. It's not creating something. Most of us already use generative AI. We don't realize it, but when you do a text and it puts that next word in,
right,
that's what it's doing. It's generating the next word. So there's nothing mysterious about this. Alexa, uses this very same, if anybody has Alexa. So many of us are already using this technology. We just didn't realize it.
Yeah, and it gets smarter the more that you use it. So
Right.
it gets more accustomed to the words that you would use. And so the recommendation for those next words or whatever get better and better as you use it.
Yeah, a few years ago, there was a program called Dragon,
Mhm.
and we used it to dictate notes, and it would learn your accent, or it would learn the
Right.
words that you frequently use. It wouldn't recognize them the first time, but it was able to recognize them as you use them. And this is
Mhm.
very similar to that. But you can generate, if you're texting, and you can generate a word, but you can also generate a text, you can generate an image, or you can generate a video.
Right.
You can choose whichever one you want. Um, Most of us know ChatGPT because it can write term papers. You talk to any high school kid, and they will tell you everybody's using it to write papers. And we saw a lot of plagiarism in the news recently.
Right.
Um, but typically we think of it as generating text
Yeah.
in term papers, but it also generates conversation. I mean, it's an easy switch from
Mhm.
text to conversation. It's the same thing, it's just in a different form. The other thing that I didn't realize is there are 300,000 chatbots on Messenger, the uh, Meta, uh, what Facebook company, um, Messenger, and there's already 300,000. So these things are they're all over the place. Okay. And if you want to know about ChatGPT, if you're interested in it, we put a little article in there about explaining ChatGPT.
Yeah.
What we're going to talk about today, though, is character.ai. What is this thing that because you can talk to a therapist.
Right.
Okay. So we want to talk about character.ai.
Yeah, and what that is it's a pretty popular platform where as you kind of alluded a moment ago, you can go in and you can put in a keyword, or you can put in something to say who you want to talk to. So you could identify a character or a person, or a profession like psychology or a therapist or something like that. And so you and what it does is it affords you the opportunity to talk with that person or that professional or that character. It's all AI, so it's not a real person, of course. It's not even a real person pretending to be someone else. It's completely computer generated,
Right.
and but because the voice recognition and everything has gotten to be so powerful, anything you say to the program, it can identify what you're asking or what you're saying, and it will respond in much the same way that ChatGPT will via text. It will respond verbally in the tone or whatever voice of whatever it is that you requested. And
Right.
so you have this very interesting now phenomenon where people would type in something like one of the most popular, one of the most common things is they'll type in psychologist,
Right.
and they will have therapy with a chatbot.
You know, now, Bernie, you know more about this than I do. You can use our cell phones do this.
Mhm.
You know, who was the most popular singer in 1955?
Right,
Well, your cell phone recognizes and knows the meaning of those words.
right,
And so it just goes to the internet and it grabs it and pulls it back and it tells you.
right.
So we have been using this. Or you go to Alexa, Alexa, turn on the Rolling Stones. Well, they know what the
You just made everybody's house go crazy because now Alexa is listening and
it's going to turn on Rolling Stones,
uh,
right? Because Alexa knows what Rolling Stones means,
mhm,
and it goes and gets it and presents it to you. Okay.
right,
So that's the kind of technology that we're talking about. It's not mysterious, but you're right. The name of this program is Psychologist. So you're going to have a conversation with a therapist who is coming to you via AI,
right,
artificially intelligent therapist. And there happen to be 475 such bots
yeah,
with words like therapy, therapist, psychiatrist, psychologist in their names. So there's hundreds of these AI therapists out there just waiting for you to contact them.
Yeah, and now certainly some of them are just entertainment,
Sure.
it's just, they're not very very professional or
Mhm.
legitimate or anything like that. But then there are those who, are really there, and people are using it in a way to, again, receive therapy. And I think you mentioned that, this is especially popular with younger folks who, and teenagers and young adults, where they're going to using these kinds of chatbots to ask it how, it'll ask how you're doing, or it will, you will ask it a question, or you'll start talking to it and it will perform sort of a an artificially intelligent designed therapeutic experience. And I think it's so interesting because, this is a case where artificial intelligence, and we talked about this before, where artificial intelligence is certainly progressing faster than we can think about things from an ethical or legal
Absolutely. Yeah.
perspective.
Yeah. We can't get ahead of this. The technology, there's some word for that. I think Alexander Turing had some term for that, that the technology, in fact, I think it's called the Turing test. Technology just evolves too quickly for
Yeah.
us to keep up with it, so, but I think there's a good message there, and that is don't panic yet, because nothing mysterious is happening here. This is technology that all of us are already using.
Right.
Okay. So when I heard about the therapist, these bots, I
Mhm.
was a little bit concerned, but then when I looked into it, when you look into it, you say, okay, this is technology that all of us are already using, nothing to be afraid of. But should we be concerned? Is
Right.
there any, because there's a program called Therapist. It's one of the chatbots. It has 12 million messages. So somebody's using this stuff. I mean,
Right.
people are already accessing it. And I'm guessing we're talking about young people. I think we're talking about the age range about 16 to 30.
Mhm.
They're using these programs and they're going to use them. So should we be concerned?
Yeah, and I think it's a great question because, we did a podcast a few months ago on Dr. Google, right? And what we expressed in that podcast is our concerns as it relates to the way in which people use Google for diagnosis,
Right.
too. They'll put in symptoms, and Google will, shoot out some diagnostic
Right.
impressions or
Mhm.
things to look at it. And
Right.
the research has demonstrated that actually most of the time Google's wrong. It's incorrect. It's it tends to pull out sometimes the most random and actually oftentimes rare conditions.
Mhm.
But it will say, it'll look like you. So people will come in with all of these diagnostic impressions, and it's just from their searches online. So we have to recognize that these chatbots really are just doing the same thing.
Right.
This is just a verbalized Google search.
Exactly. Right. Then that's how you have to think of it. What you're
Yeah.
doing, what you're already doing with Google, this is doing the same thing, except it's in spoken language rather than written language. Instead of written text, it's in spoken language.
Yeah. And that makes, I think that on one hand, so it's just the same thing as we've been dealing with for however long we've been dealing with it. But on the other hand, it does make it a little bit more concerning because, people tend to um, put more credit into things that are verbally said because it's gonna, let's just, if we're just being very honest, right? At some point, the person is going to sort of forget the idea that they're just talking to a robot,
Exactly.
you know,
You're
because back in the day, whether it was Alexa or who Siri or whoever, they it sounded very robotic. It sounded very, it was clear that it was computer generated. And now it's not. Now it's sounding like a real person. And
right.
so the more real it sounds, the easier it's going to be for us to forget that we're just talking to something that's just gathering information from the internet and just spitting it out. Not really any clinical expertise or anything. It's just connecting, using keywords and connecting things and giving you information.
And that's exactly what happens when you call a bank or you call a company.
Right.
You're getting a robot. I mean, that's not that person's voice. They're just recognizing, can you tell us what you want to talk about? And you say, I want to talk about my bill. Well, then it goes to that category. So we're
Which is
already using this.
which is why sometimes you'll say something, you'll say, sorry, I didn't recognize that,
Right.
you know, it's because those are trained within a confined, finite domain, and
Mhm.
it's only going to recognize certain words. This is something that is much more expansive, so it's going to recognize many more words, and so it's just going to pull more information.
That's right. And that's what it does. It recognizes many more words. It has a bigger vocabulary. Okay.
Right.
But it's the same basic idea.
Yeah.
Now, you talk about diagnostic applications, like you go in and say, I can't find my car key. I lose my car keys. Should I be concerned?
Right.
So then it'll give you some information. Or I feel this way. I have chronic headaches. What could be wrong with me? And
Mhm.
so it goes to the headache file and grabs all that information. There are also therapy apps, and I have to confess that I haven't really analyzed, studied any of these in any detail. So I hate to talk too much about them, but there could be useful therapy apps as well as diagnostic apps. I just have to do a little bit more work and see which ones of these are reputable, which ones are good, which ones are worth using.
Yeah.
Um, I just can't speak to it as much right now until I get more information about them.
Yeah, I think that I think you're right in that we have to remain open to a lot of this stuff, right? Because it's out there and it's going to be used. And if we shut off and we say no, this is useless stuff, let's just ignore it and it will go away. Well, first, it's not going to go away, and second, the more that we ignore it, the more out of sorts we're going to be when we're talking to somebody who has used it, or in the very least, let's know the strengths and benefits, or strengths and weaknesses of the different strategies. But I do think that they're useful because in ways that it will sometimes provide us with ideas or thoughts or things to consider that we had not considered before.
Right.
Some of us, and you and I both know, have worked with a number of people in the past who, any problem they see, um, anything they see is a nail. And so
If all you have is a hammer, every
everything
problem
is a
is
nail. And so
right.
they just see it the same way every time. And so, some of these kinds of bots, or some of these types of strategies, apps, will maybe expand people's clinicians' thoughts and how they're seeing some of their patients and some of their situations.
I, I
So
think
we
you're
have to
absolutely
embrace
right.
it.
Yeah, I think you're absolutely right. I mean, there's a treasure trove of information out there that's being organized for us. So we should take advantage of that. I think it comes under the heading of let's not be too hasty
Right.
as we move into this world. There's nothing to be afraid of. We've used this technology,
Mhm.
Alexa, help desks, Dr. Google. Most of us are already using this technology. I
Right.
think it's a matter of using high quality programs, and I think that's one of the ethical concerns. Using high quality programs, using them appropriately, and using this stuff to supplement what a psychologist or therapist is doing. It's not replace the therapist, but supplement and make the therapist better. I think that this technology can make me a better therapist.
Right. Yeah, because I don't know that, one of the things, this isn't a secret about therapists or anything like that, but one of the things that we do is we work to pull information from the various meetings and sessions that we have with patients. And so,
Right.
you know, as time passes, the more that you meet with a patient, the better you know the patient, and
Mhm.
the more history that you have, and the more consistency or inconsistency you can see in how they talk about things. And all of that is used to inform our diagnostic recommendations, or impressions, or our therapeutic recommendations.
Mhm.
I don't know that these bots do that, because you go in and you talk to it one day, and it's going to give you some response based upon what you're saying that day. But
Right.
then you come back 2 days later and you're feeling different. Something else is going on, and you talk to it, and it could give you the exact opposite recommendation because
Right.
you're feeling different. It's not going to necessarily, I don't know that it's going to necessarily remember that, 2 days ago you were going through
Mhm.
this. And so this recommendation today should be different.
Right.
So, yeah, you're right. It's not going to replace an actual human therapist, or we should be careful to not allow it to replace an actual human therapist. But it can be adjunctive. It can be helpful for both the patient and the therapist in managing some, coming up with some
Right.
other recommendations and ideas.
Right. No, but I think the technology as it exists, as it currently exists, probably very useful for practicing strategies. I think there's a lot of workbook-like things that we're able to access now. And I think there are, rather than giving a person a workbook, you're sending them to a website which gives them activities and exercises and homework. We all know about psychologists, therapists giving homework, but you
Mhm.
can do your homework online, and so I think it could provide that. Second, it's the other part about these programs is they're available 24 hours a day. So if your patient wakes up at 2 o'clock in the morning and is having a panic attack, they can go to these websites and somebody can work through it. They're not going to call their therapist at 2 o'clock in the morning, or they
Right.
might, but they're not going to call a real person at 2 o'clock in the morning, but they can look it up. So again, that's, I think, valuable. I don't think they work as well with severe, true mental illness. I think if you have a mental illness, bipolar disorder, borderline personality disorder, you're probably going to have to work with a real therapist, because I don't think any of these programs are sufficient to deal with true mental illness. If you're a little sad, if you're struggling with the holidays, you're having what we would call an existential crisis, there's probably nothing wrong with these things. You might get good advice from them. Okay. But if you have a serious mental illness, you're going to need to see a professional. They can recommend what medications are used for depression, but they don't have the clinical skill to choose the medication that works best for you. Okay.
Right.
So there are things that I don't think they're able to do. It
Absolutely.
would be useful, take a person who's homebound for
Yeah.
whatever reason, maybe a chronic illness. Well, once again, I would rather they access therapy online than not access therapy at all. Just
Right.
as a good use.
Yeah, I think that this is how it reminds us that so much of this technology, exploded truly as a result of the COVID pandemic, right?
Right. Yeah.
As we became more, with the idea of quarantining and being distant from other people,
Mhm.
that's, thinking about the last 4 years. This is when, ChatGPT and all of these AI bots really started to explode because,
Right.
people needed some way to
Mhm.
interact. They needed,
Right.
they started putting this information together. So you're right. I think it could be useful for people who are homebound or who don't have access to therapists.
Yeah, you take people who live in rural areas, like you live in, there isn't a therapist within 3 hours of where you live. Well, now at least you have access to some therapy. Is it as good as probably not, but at least you have access. So what we're concerned, I have a couple of concerns. One is, who's developing these? There's no regulation. I mean, these things just appear. Nobody's testing them, nobody's vetting them. So I think it becomes the obligation of the therapist or psychologist who plans to use them to make sure you're using reliable, useful information. The other thing I worry a little bit about is that if you go onto these sites, you're identifying yourself as having something.
Mhm.
Will the person managing the site sell your data to somebody else?
Right. Yeah. And how
Before-
is that going to be used in other sources, other
Right.
other bots?
I
Are
mean,
you going to go into some of these apps and talk about depression or feeling anxious about something, and then all of a sudden you're going to start getting, Amazon recommendations for things related to that, or you're going to start getting Facebook things on Facebook that are related to it, and all raising that suspicion that, all of these things are intermingled, and your information is just out there. And sometimes
You're
very
putting it,
personal information.
that's right. If you, you know, that's my biggest concern, is that you're now identifying yourself as somebody who has a concern about a mental illness. Is this just between you and the chatbot, or is this going to go somewhere? Because now it's on the internet.
Right.
And are you going to start getting ads for medication, for therapists, for residential treatment centers? Is suddenly your mailbox going to be flooded with, and I don't know.
Right.
But that's a concern that I have, is who's regulating this? Who's making sure that this information remains private?
Right. Yeah. There's no HIPAA. These chatbots don't
Not
have
regulated.
any HIPAA regulations. So,
And it
yeah.
could be argued that, hey, man, you put it out there, you knew this, you did it, but you did it voluntarily. So now you know,
At some point, you're going to click that you understand the terms and conditions. And
right. That's right. You're going to say,
are
yes.
you reading? Are
Say,
you
I
reading
agree.
this?
Right. You're going to hit the I agree button without reading the fine print. And
Right.
you're not going to understand the fine print if you do read it.
Right.
So, I mean, you need to be an attorney to understand most of those. So I think there are those concerns that we have, but I think in total, I think that it's probably useful technology, that we should learn about it. We should learn how to use it. There are always caveats, there are always warnings, but I think that there's stuff here that we should try to take advantage of.
Yeah,
You
absolutely.
mentioned something earlier that I want to emphasize a little bit more. You talk about the limitations of the information on the internet. ChatGPT only goes back to 2021 or 2022.
Right.
That's what it accesses. Okay. Now it will continue to add 2022, 2023 to it. But right now, when you access these things, you're only going to access what's in the system, what's in the memory banks. Okay. And so you may not be getting the latest or the most accurate information. So
Right.
you need to recognize that too, that there are some limitations here, even with the amount. You're not getting up to the minute information. You're getting what happens to be stored in the system.
Right.
So that would be a limitation. But by and large, I think on balance, although it was scary at first to think that I'm going to do therapy with a robot, that's really not what's happening. And there's probably some useful stuff here that we ought to be taking advantage of.
Absolutely. So we'll keep everyone updated as we learn more and as more becomes available, because you know what, we know that more is going to become available. It's going to keep growing. So
That's right. You can't ignore it. I mean, that would be the biggest mistake, is that you just ignore it, or you throw the baby out. Don't throw the baby out with the bathwater. You know, there's stuff here that we should be using and taking advantage of.
absolutely. All right, that's it for today. Until next time, stay happy, stay healthy, and forget to be afraid.